Hello and welcome to another episode of Containment with Fulbrighters. It's an honor and a privilege because Zaeem Zia has joined us today. He's a hard man to get a hold of because he's been awarded an award by the president, by the prime minister. He's been recognized by Mike Pompeo. He's done an exemplary job at managing the public health crisis, especially being in the epicenter like Islamabad. First of all, how are you doing, sir?
Pretty good. How are you?
Good, good, good. So for people who
It's a
might
it's
not,
a
yes, sir.
it's a pleasure to be with you. By the way, I mean I've seen a lot of your shows, and I think you make really good jokes as well.
Thank you, sir. Thank you. It's the pleasure is all mine. For people who might not know, Zaeem Zia has a Fulbright Masters from the University of Oklahoma in public health. So, sir, let's get right into it. How has the experience been over the past year of managing COVID, especially in a place like Islamabad?
Islamabad is a very tricky place to work with because it's also like it's a center for a lot of areas in the country. For example, the northern areas, Gilgit-Baltistan, AJK, KP, Sindh, Balochistan, and Punjab. Everybody actually wants to come to Islamabad for some sort of like either recreation, treatments, transit, national and international flights. So it was a pretty tough job. But then you know how it is when you have a background of public health, and then what are the things that those are important to put in place so that we can fight a pandemic. Pretty tough, but I got lucky enough to get an amazing team in Islamabad, and a lot of my uh, ministers and the secretaries and the bosses were pretty good to me. So we managed to do it.
So, if we managed to turn back the clock a year ago when it all started, can you tell us about that experience? How you were first made aware of it? What were the first initial steps which were taken?
Okay, so it was interesting when I started when I back in Gilgit, when the first when it was we were informed about some sort of like virus, you know, um, spreading from some countries in the world. So I was back in Gilgit. The first thing, so it was interesting back in the days when the COVID landed in Karachi. It was funny how the guy was making videos of his book videos telling them that I have met you and you're one of the you know possible carriers, or maybe you might catch virus. So back in Islamabad, we all know that entire globe was not ready for a pandemic like that, and likewise we were not ready either. But then whatever we could, we started from the scratch and then built a system that could basically cater for all the necessities that are important to contain any sort of like pandemic, or that's how we, with a help of a great team and uh, ministry and Hamza Shafqat, the deputy commissioner, we all managed to do better.
As you said, it was quite unprecedented. No one
Done.
was aware of what COVID-19 exactly is, and you talked about the systems that were put in place. If we can go through the process of what systems were devised, especially for a novel disease like this that nobody was prepared for.
Yeah. So I was telling you about how the first case landed in Islamabad, and again, um, so we didn't have much in place at that time. We got the information that there's the first case landed in Islamabad, and he's wandering around Islamabad and driving around, and we could see that we had the we geofenced the patients at that time. So we received the number, the number on the geofencing, and we realized that the patient is basically driving through Islamabad from F10, F8, and then they kept on driving so out of Islamabad. So there are a bunch of people from my office and the security offices. They were following him actually. And the funniest part was I was on the road as well as the deputy commissioner Islamabad as well. So pretty intense. So we kept on like following the guy, and he landed in KP somewhere, and we got hold of him there through the district administration in KP. But later, as we knew that there will be more cases, so we put all the surveillance systems, get more people aboard, train people, enhancing the contact tracing, and also that we had to do a lot of risk communication. There are certain processes that we have to look at. We have to build a system where our office had to be the center and the pivot for everything, so that this office is coordinating with the laboratories and the private. So whenever they get a positive, they should report to us. And then there was, National Institute of Health, where we had to send all the samples that we take um, as a part of the contact tracing and send them, and then we get the results. And then there were teams on the field who would go out there, following the positive patients and then quarantining them, and also the support from the police administration, and also our different agencies together. So we put a system in place, and luckily we were able to start functioning within 1 month. And through the course of the time, we grew, and we enhanced our systems, and we got a lot of appreciation from national and international health partner agencies.
In terms of the work that you do, you're sandwiched in between two different two different identities, right? There's the government, which has certain policies that they need to put in place. They're thinking about the country, they're thinking about the economy. And then as a public health officer, the public trust is something that is very valuable to you. How do you balance the two?
Uh, it was like I said, very tricky part that Islamabad is, when you look at like the is a power corridor, right? Um, Here's all the highest offices in the country are here, and every office is their own secretary, and every office definitely would want the. And then people living in Islamabad are very well, well connected on multiple levels. When we talk about the trust of people, I think it was the hard work of the administration at that point, being a public health professional, at the same time the administrator in Islamabad for healthcare. We were more responsible to gain the trust of people, at the same time knowing the fact that there are people with the myths. The corona नहीं है यार, corona ऐसे ही है, किसी ने ना होश से, किसी ने ना अपने उसके लिए पैसे लेने के लिए बनाया है. Fit in different myths, you can tell me the myths, I can answer you about them, how we helped. But being there, persistence, patience, and perseverance helped us, at the same time gaining trust from people. And initially, what used to happen, people would say, who are you guys? Why? To my teams who are going out there for contact tracing, right? So they say, why are you here? No, we don't know any teams like that. Nobody does that. So this is Pakistan, okay? Nobody goes to door to door and takes samples. The best part was, from Islamabad, we have taken 150,000 samples from the doorstep, and that did not happen anywhere. And that's how we managed to gain the trust, as well as gain the trust from our different departments and also people.
Do you also have to take that back and then relay it to the government? So, for instance, in terms of the lockdown, there was a huge debate at that time of what to do. And especially being in Islamabad, maybe the opinion was different slightly, or I would assume that maybe in far flung areas, having a lockdown, at least having people in support of the lockdown, was probably harder as opposed to Islamabad, where people were calling for one.
Like I said, Islamabad was a very complex station to deal with. Multiple offices in Islamabad, and also it's a transit, it's national international flights. When the burden was flying in of the disease, so we were looking at different areas where the virus might come from here, from there, but there was a major bulk of the virus actually flying in. So in these situations, urban areas were more vulnerable than the rural areas, frankly. I mean, you talk about Islamabad, but there's different parts of like Sindh, Karachi, Sindh, Punjab, KP, and Balochistan, where you have more population, there's more spread, right? So when people do not follow, so we started, the smart, we call it smart lockdown, which was later taken up by different countries as well. So the smart lockdown really helped us to contain. You know, one thing that I realized is smart lockdown wasn't just um, containing the virus per se, but it you know, when I would drive by somewhere and I see people like flocking together, not wearing masks, nothing at all, no SOPs. So I would find a place where there is more virus so I can lock it down. So the moment I do it and it gets announced, entire Islamabad was like empty, like nobody on the streets. And we and some of the administrative vehicles would just be driving around and nobody else. Um, Pretty tough, but fun as well.
I think you also mentioned that containing is the hard point. As was there some point in the pandemic where the administration realized that containment is not the strategy? We're not going to contain it. There's just too much virus. Now it's mitigation.
Look, the virus was there, and until and unless there was some remedy for it, nationally and internationally, we cannot just contain a virus in a packet. Sure, you can do surveillance, you can contain. Look, if you are quarantining 100,000 people, so you have to provide them with a lot of other, necessities. They have to live their lives because they would need to go out to the markets to buy vegetables, and you have to cater for them as well, right? So you cannot just lock it down, but also provide. So given the the amount of uh, the scale of pandemic, very difficult. But scientifically, and the data that we have right here in this office shows that we contained the virus. Now, containing we might have different definitions for containing, but I'll give you my definition of the containing is to not let the virus spread more than what we can handle. So there has to be virus, sure. We had a deal that there has to be a certain limit virus because you cannot eliminate it. But at the same time, if we say there's a percentage of 100 people getting diagnosed, 3 or 4 will be critical. 70 to 85 people will be 70 people will be asymptomatic. 20% will be mild, moderate, and the symptoms, and then 1% would die. So the number of the patients in active cases in Islamabad would tell you how many patients you're going to get in the hospitals, and also to the intensive care units, and how many out of them would die. So we had all the mathematics in our hands. We would not let Islamabad cross 5,000 active cases at one time, and sometimes 6,000, depending upon the viral load.
So now that we're a year on from all of this and the great job that you've done, now we're thinking vaccines. Where is Pakistan in terms of vaccines? And in terms of Islamabad, do you have an idea or do you have a suggestion as to how the vaccine should be rolled out? Who should be high priority first?
Look, I had the Islam's vaccination program right now, and I'm actually vaccinating a lot of healthcare workers frontline. And was categorically decided by the National Command and Operations and the Ministry of National Health Services that will go with frontline and healthcare workers, and that's what it happened. And again, myths come in. ये virus जो है इंसान को पता नहीं क्या कर देता है, क्या कर देता है. But myths happen everywhere in the world, be it, the developed or the underdeveloped countries, everywhere. So we had to, get some of the famous people who might show their faces out there on the, see, I'm getting the vaccine, and you also should get it. And the Federal Director General and the Minister also got the vaccine because he's a doctor as well, as a frontliner as well. So a lot of people, and I myself got the vaccine. We told our people that, see, we are getting it, so it should be okay for you as well. So get your vaccine, be safe, and save patients as well.
How was the experience of getting vaccinated? Like, did you get a chip? If we're discussing all these myths, did you get a chip? Did you suddenly realize you know
I
Chinese?
actually
What
did.
happened?
Yeah. I mean, I didn't even feel nothing. you it's just all the cameras were on my face, like the moment when I was getting my vaccine, because it was a thing, right? That the head of the systems getting a vaccine in Islamabad. So because the media would cover it, and then I was like sitting there, I just felt a little prick, and that's it. Nothing else. Nothing happened actually. I'm living in front of you,
So
and I'm vaccinated.
what do the next few months look like in terms of where Pakistan will be in terms of vaccination? I know the US is claiming at least that by the summer everybody will be vaccinated. Biden says start of the summer. Fauci says end of the summer. Are you ready to make any such predictions for Pakistan?
Well, look, we have to vaccinate a certain. See, the frontliners are done. They're getting vaccinated every day in Islamabad. Around 800 people are getting vaccinated. They are the frontliners. We have vaccinated almost 8,000 people who are the frontliners. 8,500 maybe from now today. That's a huge number of the frontliners to get vaccinated. But when it comes to plus 65 or plus 60 years old, we have registered them, and we have the consignments coming in for the for the elderly, and we have systems in place. And so vaccination centers are in place. We can, if we are given a go ahead, administer all the vaccines needed in a given time of maybe for elderly population 150,000, we could get it done in 22 days. And for rest of the people, like 1.4 million people, we can get vaccinated in the next 200 days. So it will take some time. As soon as we get the consignments, we get the stocks, keeping all the total formalities in place, we'll be vaccinating everybody. And
So
that's soon. Probably by the end of the year, we'll be
so this is
set.
Islamabad
Yeah.
specific. If we are to maybe predict in terms of Pakistan, are we still looking at the end of the year that hopefully by the end of the year all Pakistanis will be vaccinated?
Right. Yeah. That's what I said, because we follow the similar timelines. So there are 6 units, and the 6 units report to 1 unit to the NCOC in terms of vaccination.
So
So we respond well.
all this great work that you're doing, it's actually quite an honor for Pakistan for you to be here and doing all this work. How did the Fulbright Masters help with that, or things that you learned in your Masters in Public Health? How did that prepare you for some things as unprepared as one can be for things like COVID-19?
Look, it's a technical capacity that I on my social media, whenever like I was interviewed, a lot of people asked me the same question: how did it help me? It helped me to build that capacity and understanding, uh, to basically come back and build. I always face the problem whenever I go and I would want to do some of the things in a certain way. People say, "ये अमेरिका नहीं है." So I say, "Sure, अमेरिका नहीं है, तो let's make it America." As in terms of like systems, systems to deliver some of the healthcare services, or maybe the standards of care, or maybe equipment, or maybe there are a lot of other things that we can actually, you know, fix some of the systems. For example, if somebody is sitting here, to enhance the productivity of somebody in the room, you can ask some questions like, "What did you do the entire day?" And somebody sitting on a table doing nothing would say nothing, right? So we keep people accountable of, please tell us, how did you what did you do the entire day? And we have teams. Fortunately or unfortunately, my team hasn't taken a break for 1 year. No vacations at all, and no Saturday Sundays, honestly. And this is not just I'm not just saying it. And there are team members sitting here who've done an amazing job. And I would never think that anybody would do as much as these guys have done on the front line specifically. But surely it comes, it's all about the capacity and understanding of the technical knowledge that comes from the degree from, of course, my university, and supported by the Fulbright.
Like you said, let's make this America. I think what you're talking about is also that it's not just what you learn in college. And as a Fulbrighter myself, I will testify to that. It's not just what you learn in college, it's what you see around, what you can bring back. So in terms of the cultural exposure, were there things that you experienced there that you have now brought back and incorporated into the work that you do?
Look, I mean, of course, every person has their own basic personality as well, and I think you cannot change everything about a person when you're. There is also element of your culture that you are grown in. I'm from Gilgit. You know how um, there are a lot of people with lots of energy, and like when you see them dancing sometime, you would know they have a lot of energy. And also that the commitment is more of your understanding of your own responsibilities, being aware of your own responsibilities rather like just responsibilities. And I think coupled with that, the technical knowledge that we learn from sort of degree program, and then coupling them together would make a difference. I mean, we have seen a lot of people studying from abroad, or maybe like coming from the areas that I come from, or maybe the rest of the country. It has to couple together and supplement each other or complement each other, and it's not just like mutually independent. So that's how you bring them together. And there was a point where a lot of different people would offer places because but it was a time where you cannot just leave the responsibility you have for a better opportunity. So that was very important, because if you leave at that time for a better salary, maybe for better opportunity, it's your character basically. It's nothing to do with, sometimes education doesn't help you. Sometimes it's the culture, it's the commitment that you ingrain and inculcate in yourself, and then having all the things in uh, place to come up with something that would help people at the end of the day.
I think you've probably already inspired so many people just by saying that. But as somebody who's from Gilgit and has managed to go to the US, learn, come back, and now is at the epicenter of a lot of things that are happening in this country, is somebody that all of us are looking at in terms of what will happen, what to do. Uh, so the path that you've managed to make for yourself, is there any word of advice that you would like to give to other people who are probably hearing this in other areas in Pakistan, who one day dream to be where you are? Is there any words of advice for them?
So a lot of people, when they come meet us, or me especially, and they say, "हमारे लिए ये कर दे," so I tell them one thing: listen, keep fix your trajectory, and do not like try to be a paratrooper. You have to go through the pain and the processes. And I have seen a lot of brilliant, intelligent people failing, but I have never seen hardworking people failing. Trust me. I'm talking about my own observations. So there's no shortcuts to the success. Maybe not that I think I'm a successful man, but also there should not be any compromise on your self-esteem, compromise on your values, or maybe your culture. No matter what we do, like we turn back, come back, and be. I'm talking about ourselves, like the people from the north.
Hmm.
No matter where we are, we still remain Kyrgyz,
I think that's as good as words as any to be true to yourself, and especially in terms of self-esteem. I think there are a lot of people who see other places and then turn that into an inferiority complex or start feeling not great about themselves. But the idea is to learn these things, see what works, bring it back, and see what works in our context. Especially when I talk to Fulbrighters, I realize that they have the expertise to bring it back to a local context, as opposed to what some people in Pakistan do, which is just wholesale bring about changes without that sensitivity to local traditions or local culture. So thank you, sir, for all the work that you do and all the work
To
that you
that,
continue doing.
thank you very much. It was indeed an honor to be, and I'm really sorry for you not being able to get hold of me because it was so much fun.
No, no, no.
I'm
It's
sorry,
I
and
wish
good luck
we,
with
whenever
this.
I'm in Islamabad next, and we are vaccinated, we'd love to meet you over dinner and continue our conversation. It was an honor and a privilege to
And
have you, and for being a hero and everything that you do. Thank you, sir, and thank you everybody for listening. Take care. Bye
thank you
bye.
very much, sir.